At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome. Dr. Tom Roselle here, and we got another great program for you, as always. Listen, everybody's wonders about hormones, and we want to continue to shed the light on that a little bit as we're going to get real clear on the subject coming up this coming Wednesday, the 13th of November, at the Roselle Center for Healing in Fairfax. It's real easy to get there. We're less than probably a third of a mile or maybe a smidgen more off the National Capital Beltway on Route 50. Then you turn onto Prosperity, and then you turn right on Executive Park Avenue. We're right there. So join us, and we want to prepare for you. So make sure that you let us know if something comes up that you can't make it, but go to drtomroselle.com or rosellcare.com. That's ROSELLECARE.com. Listen, we want to encourage you to do a couple things. One is make sure that you like us on all the social media sites so we can get this word out to as many people as we can, so we give you the tools, if you will, to help yourself, to have the information, to ask the right questions, better questions about your health. And particularly now, as we look forward to medical freedom of choice, I will encourage you and give you information. And if you want to ask a specific question, you can do it in a couple of different ways. One, you can simply send me a note through Roselle Care. Go to the radio site, Dr. Tom Roselle, but we're here every Sunday on WMAL 105.9 and try to give you as much data, much information as we possibly can. Now, having said that, remember, right after the show, immediately after WMAL, we're going to our live stream, and that's Ageless Health with yours truly, and you just go to drtomroselle.com, or make sure you like us, because if you do that on social media, we'll let you know when we go live. And all you got to do is click, and we're right there, and we'll continue the conversation. That's supposed to be an easy kind of toe-in from one program to the other, so let's make that happen. By the way, we have a program in the office at Roselle Center for those of you who would like us to come to your different organizations, whether it's the church, whether it's a social club, whether it's a group of people, your office place. All you have to do is reach out to Roselle Center for Healing and go to Roselle Care, if you will. That's how you find it. Or call the office, 703-698-7117, and ask to talk to Dareth, and she will set that up. And we love to do that. It's part of our ongoing community outreach program that we do with our foundation, Caring for Others. So if you'd like us to come to you and do a presentation on anything about your health and give you the tools that we need to do in your organizations, make it real simple for you. Just call the office, ask for Dareth, and we'll schedule that. And yours truly will come. I do several of those a year because I say I will give X number of hours. And remember, Caring for Others, our foundation, is a great organization. We help as many people as we can who have absolutely nothing. Having said that, let's get in the program. We're going to talk a little bit about signs of hormonal imbalance. Now, I kind of position it as 10 signs of hormonal imbalance. And what I want you to understand is that all the things that we've been talking about over the last several weeks with the thyroid and the adrenal system and the pituitary gland and the ovaries and all the signaling mechanisms, but I want to give you, if you will, a source of, if this is going on, I need to start thinking about this, right? So we can talk about loss of libido, like you have no desire whatsoever to have any intimacy with anybody. It's like it's gone. There's a reason for that. How about acne? How about dry skin? How about weight gain? How about headaches? How about depression? How about ladies, you can't get pregnant if you're trying to do that. Guys, erectile dysfunction is not being solved by anything. Even if you went and took Viagra, Cialis, or any other drugs, it doesn't seem to work for you. Why is that? What's really going on? How about increased thirst? How about mood swings? How about, depression and anxiety? How about all of a sudden you're getting a lot of facial hair? Ladies, where did that come from? You're not supposed to do that. And would that be a sign? Probably. How about constipation? Yep, that's part of the puzzle as well. When your brain doesn't work, it's called brain fog. And we could go on and on. And a lot of these are overlapping possibilities. There's this thing called osteoporosis and osteopenia. We've talked about that several times, not only over the last several weeks, but in the past as well. It can be a very direct result of hormonal imbalance, particularly a couple. One, ovaries production of estrogens, but also the parathyroid gland with the production or lack of production of parathormone, and which is the primary director, if you will, for calcium metabolism in the body. So having said that, do you sit there and say, oh my God, that's me? Oh my God, what am I going to do about it? There's a lot that you can do about it. And even to the point of, a magic wand, and I don't say that lightly. What I want you to understand is that magic wand only exists if you know where to point it, which direction, what's really going on. When we look at any condition, we look at the why behind it, not just here, take this for that. We want to know what's causing it. We want to know if, in fact, that there is a neurological triggering mechanism of an injury may have taken place over time, or a neurochemical trigger. There's not enough of something in the body because of blockages, meaning signaling blockages. That means that our environment in this country, unfortunately, is not the best. In Europe, there's a whole lot of our foods and products and so forth, they won't even let in to their country. Now, if they won't let it in, there's got to be a why is that, right? There has to be something that is amiss. Why is it that some of our products have 15, 16, 17 additives, and overseas they have 3 or 4? I don't know about you, but that gets my attention. One of the things that, and I don't want to bring up politics, but I got really excited that Robert Kennedy is going to be involved in looking at healthcare, because he's going to take that veil off of a lot of different things. I'm really excited about him. Peter McCullough is another one. Del Bigtree. There's a bunch of people out there that we need to pay attention to that are telling us that something just ain't right. And if we understand that, then we can help each other by asking the right questions of the people who are supposedly leading us. And whether it's the right side of the puzzle or the left side of the puzzle, I really don't care. I want the truth. I want the ability for you to have the information that you need to have. So let's get into this a little bit so I can begin to trigger it. And as we lead into the live stream program today, I'm going to give you some answers. And I want you to really understand, what the mechanisms are. But, let's talk about just pain patterns. And there's a tremendous amount of articles out there about, your arthralgia. When you hear that word arthralgia, what does that really mean? That means that arthros, joint, algia means pain, and you got joint pain. And specifically, it can be a symptom of injury. It can be trauma. It can be an infection. It could be a long-standing illness. It can be a reaction to certain medications. But arthralgias can also be a result of certain mechanisms in the body, namely the fight-flight system, the adrenal system, not putting out the hormones, its own steroid packages that you need to put the fire out. So we're not going to get into, obviously we can talk about that straight across the board. How about, just the loss of libido? Libido has to do in men and women with one specific hormone that's called testosterone. And it may be pegged as a male hormone, but ladies, guess what? You got it as well. And if your testosterone level is too low, you could give a flying, whatever about any kind of intimacy with anybody. Loss of libido at that point, say, well, I'm just not, I'm not 20 years old anymore. But if your testosterone level is lower, than what it used to be. First, your muscle mass is no longer there. You kind of got flabby arms around and flabby legs and, flat butt and things of that nature. But you also have no interest, none, or very, very little in any kind of intimate relationship with anything. So the hormonal changes can occur across the board, as we've talked about, guys as they go into andropause, meaning their body's gotten beat up. It shouldn't happen that way. Ladies, as you go into menopause, again, it shouldn't tank. You should still have an interest, if you will. But low libido is a common situation, both guys and women. And, guys are saying, well, I have to still be the stud. I still have to, and everybody's out there, and we have a multi-billion dollar industry in erectile dysfunction and hormone replacement and things of that nature. What happens if I told you that this could be modified significantly, and even in many cases totally resolved, by doing certain things? Well, I'm going to cover that on the 13th. Dr. Stephanie Pina, who's a doctor in naturopathic medicine, and I are going to be going over hormonal dysfunction. And I think you're going to find it very interesting that there's a lot that you can get done. But the problem that we're seeing with people in today's world, particularly with all the anxiety levels and all the depression signs and the like, is quite significant. But could it be due to hormones? Yes, it could. Depression, if you will, is a mental state, or better put, neurotransmitters that affect the brain that allow you to have certain mood expressions. I'm being kind right now, right? So it really affects about 3.5 to about 4% of people around the world. That's a lot of folks. That's 280 million to 300 million people of all ages. And when you see that, that could be problematic, right? What happens if somebody's really depressed? Well, sometimes they take themselves out. But what happens if they decide to take company with them? That's not okay. Everybody's got a choice, but my goal as a doctor, as a physician, is to make sure people have the capacity to optimize their health. And that's what I've gone with for almost 48 years of practice, making sure that my patients, you understand that in particular cases like anxiety and depression, moodiness, if you want to call it, just, dramatic swings of emotion, one side to the other, that you understand what it's really all about. And it just didn't suddenly happen. It may have seemed suddenly, but there was a cascading effect that took place over a period of perhaps years, but you were ignoring them, or you were taking different medications that exacerbated the problem and made things worse as time went on. And again, we're going to talk about that this coming Wednesday evening at 6 p.m. at the Roselle Center for Healing in Fairfax. And all you got to do is give us a call at 703-698-7117 and tell us that you'd like to be there with us. Or better yet, just go online at rosellecare.com. That's ROSELLECARE.com. And by the way, all my websites are kind of interlinked to each other, so you can find me one way or the other. And by the way, brings me another topic. If you want to ask a question directly, you can do it in several ways. When I get onto the live stream, you can actually send a note through the live stream while I'm live, and I'll do the best I can to answer while we're on air, or do it privately. Just go to rosellecare.com and do it that way, or go to drtomroselle.com, and I promise I'll answer you. Those of you who sent messages out know that I do respond. I don't let you hang, and we want to make sure that you have the tools, you have the capacity to be able to turn things around. So we're talking about different signs and symptoms of hormonal imbalance. How about changes in blood pressure? What would cause that? Could that be a hormone situation? Possibly. You get changes in your heart rate and your blood pressure. And so when that happens, what could be the triggering mechanism? Well, one of the primary drivers of blood pressure regulation and heart rate is our friend, the adrenal glands again, but the inside of the adrenal system. They produce something called catecholamines, and they help regulate with norepinephrine, epinephrine, and so forth. They help regulate the pump, your heart. They help relax and strengthen the blood vessel push to get your blood throughout. But if it doesn't do what it's supposed to do, sometimes your blood pressure goes way up. And if it does it, to the place where it gets fatigued, but sometimes your blood pressure crashes and you're not working the way they're supposed to. So, and there's a fight flight that's constantly going on about, who wins and who loses in certain situations when it comes to certain neurotransmitters, certain amino acids, and so forth. One that I'm talking about right now is simply this. It's something called tyrosine. Tyrosine is needed in multiple areas, but two major areas. One is your thyroid. It helps in the production of T4, thyroxine, but also in the central portion of your adrenal system that helps regulate that blood pressure and so forth. So if you're getting changes in your heart rate, if you're getting changes in your blood pressure, and there's other pieces that go along with it, it simply could be that adrenal, that fight-flight system is not producing the hormones that it should at the levels that it should for very specific reasons. And if you dig deeply, you're going to be able to notice what they are and find out and move forward accordingly. But what I'm here to tell you is simply this. There isn't any changes that occur in the body that if you understand the mechanism of how it got there, that you can't fix. Unfortunately, in our world, that it's take this for that. And I want you to put your feet in the sand and tell your doctor, no, I want to know what it is. No, let's fix the problem. What can I do to become proactive in my own life to make a difference? Maybe something as simple as, guess what? Going to bed every night at the same time before midnight and turning off the stupid tube and dropping your room down to about 65 degrees and sleeping with blankets on and keeping all the lights off, get all the iPads and the computer systems and those watches you put over your wrists and so forth. Get them off your body, so you get your blood pressure through the night. So, whether or not you're staying asleep. What good does that do you if you're doing it every night, if you don't do something proactive to change it? You just wake up and you're in an anxiety state, you're depressed because you don't know how to fix it, and your doctor says, take this and let's see if we can put you to sleep, or you need a sleep apnea device, or you need whatever. I mean, it doesn't make any sense to me, but call me, kind of old school, but I still like to know why behind certain things. I like to know how to fix certain things. How about your brain? What happens if you got, that initial stages of memory loss and your head isn't sharp like it used to be? Could it be a hormonal problem? You bet your bippy it can. Absolutely. And that's the first place that we all need to look at. Not necessarily, it could be other things that are much more serious, like, the adjuvants that are in vaccines. What's an adjuvant? Adjuvant is mercury, adjuvant is aluminum, things like that. They're called stabilizers, but they cause significant amount of damage to the neural system of the body. So there's ways of finding that out. In my world, when I examine a patient, every muscle in the body has a relationship to organ systems. And you say, Dr. Tom, how does that work? Well, here's how it works. Your brain, your spinal cord, your central axle transmission place of the body, right, has 31 pairs of nerves. Those nerves come off and they divide. One branch goes inside the body and hooks up to an organ system. Another branch goes outside the body and hooks up to the muscle. So that muscle and that organ are constantly talking to each other. So if the organ's not working well, then the muscle that's associated with it may not be working well. And remember, we'll go back to the first thing I talked about today. It's called arthralgia, pain. Well, that's how it can come about, because that muscle now is not facilitated properly. So it doesn't have the tone, the strength, even, because if you're not an athlete, you don't work out the way you're supposed to, but it should still have the ability to work and express itself unless that mechanism is not working the way it's supposed to. So that's one of the things we do when we look at the body. We can tell by certain muscles things aren't working the way it's supposed to. I've had patients lift up their arms in a lateral pattern. And even if they didn't come in with that problem, I'll say, and they can't get their arms all the way above their head, I said, do you have a problem, remembering? And, they did a little stuff, like you walked into the room, you forgot why you were there. Little triggers. Have a problem, not remembering names, have a problem keeping focus and so forth. Those are all hormonal changes. And we have to understand where they're coming from. Not just, dope people up with all kinds of things and, then they go into other stages and other problems and so forth. Here's the deal. When you know the why, and, you'll get physicians say, well, it's the why is only something that we're guessing at because we don't have the thousands and thousands and thousands of patients studies that show exactly this. What is it called? Scientific evidence. How about clinical evidence? How about the doctor in your life who's been in practice for forever has certain observations and they're aware that certain things present themselves in certain patterns, but you have to have scientific evidence. Again, clinical observations, sometimes as old as folklore, observations in medicine. Those are the things that you need to really understand because it's called clinical practice. Now, it doesn't mean that you're going to practice on you, but it means that you have to be aware that there are certain things that work and they seem to work repetitively. You told me years ago that I'd be practicing in natural medicine the way my grandmother treated us with onions and garlic and things like that. I'd say, oh, really? I don't think so. But we're going to continue this conversation just in a few moments on Ageless Health Livestream with me. And so all you need to do is go to drtomroselle.com. That's drtomroselle.com, and click and follow me. Or if you have it on the apps, you've already liked me, follow me there. Okay, we'll see you in a couple seconds. Remember, I do this every week for one reason only, simply this: you deserve it, and I love you all. Don't forget to switch over right now. I'll see you there in a minute.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Ooh.